Hello, everyone, and welcome to Caring for Patients with Sickle Cell Disease in the Emergency Department, Overcoming Stigma and Anti-Black Racism. I'm Dr. Jennifer Bryan, an emergency physician at the University Health Network in Toronto.
Hi, everyone. My name is Serena Thompson, and I live with sickle cell disease, and I'm a warrior and advocate.
More than 5,000 Canadians have sickle cell disease. Most affected in Canada are Black, but sickle cell affects people of all races. There are no biological differences due to race. So if you see racial differences in health, you need to look further. The risk factor for having sickle cell isn't race, it's having ancestors from malaria endemic areas. Vaso-occlusive crises or pain crises are a common complication of sickle cell disease. In contrast with other causes of pain for which we often prioritize care, like renal colic, early treatment of pain in sickle cell can actually decrease rates of hospitalization. Our patients describe being seen as drug seeking. An American study showed that most emerged physicians thought that at least 20% of patients with sickle cell have opioid use disorder. In reality, that number is less than 2%. There's no emergency department investigation that can confirm that someone is having a pain crisis. We just need to believe our patients. Pain assessment is a high risk area for bias driven by anti Black racism. Many of you participating may be familiar already with Serena Thompson from the August 2020 CMHA article or her work on CBC. Serena is the interim president of the Sickle Cell Association of Ontario. Serena.
Thank you, Dr. Bryan. Um, I'm just glad to be here and I'm able to share my story. I am a human being. I live with pain every single day of the year. Diagnosing me and my parents at the time of my birth devastated them. I'd be spending the rest of my days in pain. Sick Kids Hospital became my second home. Scarborough Grace Hospital became my second home. That saved me. Why? Because of a protocol. My pain is so real, and the protocol helped advocate for me. IV, oxygen, and pain medication. IV, oxygen, pain medication sounds so simple, but yet it's so challenging to receive basic care. Oh, wait, is it because I'm not dressed up? Do I look approachable at 4 a.m. in the morning? Let me just get a comb. I apologize for looking like I just rolled out of bed. I don't want to be here, but the pain is too much. The stress, the anxiety. I'm here because I need help. Please, will you help me? I've been here for hours. It's very unusual. You don't look like you're in pain. That's because I'm used to it, but not the intensity. Do you have a protocol? Can you help? It would be nice to see a change after 48 years. Yes, unfortunately, that was my boyfriend who dropped me off, but the pain is too much for him to witness. So I'm here alone, fending for myself, hoping someone understands. What am I going to do? What am I going to tell work? I hope they understand. I don't want to be let go again. And rent is next week. And my finances are not enough. I can't stay here. I must go back to work. Empathy is all we ask. All conscious and unconscious biases are real, but I am a human being. I wanted to express myself that way because I feel the only way someone is going to understand what we go through is by visualizing. And hopefully that gave you a little snippet of what we go through as sickle cell warriors. We usually just, we usually just live our life, regular lives, work, school, relationships, children, um, and family, and all that gets affected once we are in pain and go into the ER. Once we reach the ER, um, the longer it takes for somebody to process us, the longer it takes for someone to for a healthcare worker provider to assess us and really um, understand what is going on and how important it is to treat as soon as possible, the better. So that is one thing that we're struggling with right now. We're struggling with the timing of being attended to when we do present with a crisis. By the time that we do present in the ER, the pain is usually at an excruciating level. Why? Because at home we're trying to we're trying to deal with pain management at that time once our crisis starts, only because we do not want to go to the hospital. We try to deal with it at home. We try our best. Maybe even go to work to, uh, you know, maybe we go to work so we can just take our minds off of what is happening. Maybe we just stay home and still try to manage it. But when it comes to that point where it is so excruciating and the pain medication is not working at home, we have to come in. But then that's another battle. Once we arrive, the intensity of the pain is questioned. Or the amount of opioids that we need is questioned, or sometimes frowned upon because they will sometimes try to give us less than what we know works for us. And because of the only reason why the opioid um, dosages are so high is because we're getting older now, and it is something our body is getting used to. And then we have to find another way of treating the pain if the old method doesn't work. And so sometimes, yes, our dosages are going to be extremely high, higher than usual that you've ever seen. But it's something that we're used to. Our body can take it. And once it hits that pain, we're able to have an actual conversation and say maybe why we're in pain or what started it, or maybe we just overexerted ourselves for the day. Because that's always a question: what started it? Or what do you think you did during the day that started? And sometimes it's nothing. For me, I get my crisis in the middle of the night while I'm sleeping, so I'm getting it at rest. So I can't say that I did something strenuous while I was, sleeping. So, and then we're trying to cope. We see other people in the ER that, are going through things as well. But if someone came to us and with empathy and said, you know what, we understand that you're in pain. We understand you're having a sickle cell crisis and we want to treat your pain as soon as possible, but maybe we're waiting for the doctor, or like let us know instead of letting us sit for hours waiting to hear back from somebody. And these times, it's even harder because we try to advocate um, with our um, with our colleagues, and we try to advocate to let them know that you can bring somebody with you to help you through that time. And during these times now with the pandemic, it's not possible. So our partner patient care is missing. And the anxiety, as I mentioned, does rise, and just propels us even more into the pain, thinking back to the pain, and then the pain, overwhelms us. It's searing, it's throbbing pain, it is constant, it moves around. it's just stuck in your joints and you can't do anything about it. So what is it? What is it that is preventing us from receiving prompt and efficient care when it's pain? I know it's invisible, but you have to believe us because this is something that has been with us all our life. And we understand that everybody has busy lives. We understand that. But when it comes to treating pain that's you can see because somebody is bleeding, um, it's it's the same pain that we're having, but we're not bleeding. But it is in our blood, it is in our joints, it's in our organs, and this is something that we want to preserve and try our best to live as long as possible. I was I was told I was told at a young age that I wasn't going to last past 20, and that was here in Canada. I was told I was not going to live past 20. I've lived way past that. I have seen a lot happen. I've seen a lot of people leave us because of um, complications due to sickle cell, and we don't want that anymore. We want people to be able to live their lives and be able to just function normally like everyone else. And the fact that I had a death sentence looming over my head for the first 20 years of my life made me think, well, what's the point of finishing school? What's the point of going to work? What's the point of having friends? What's the point of having relationships with people? And it does take a toll. It takes a toll on you. Now that I'm older, I still think about those things, but I see what is possible. And with modern day technology and with a lot of education, we can change things.
Thank you, Serena. For patients with sickle cell, part of the reluctance to go to the emerge comes from fear about how they're going to be perceived by healthcare workers. Underlying that is a lifetime of experiencing stigma and anti Black racism. Healthcare in Canada exists within the larger cultural context. We're not immune to anti Black racism. Racism is the belief that people of different races have shared characteristics that make one group superior to another. At its heart is white supremacy, the idea that being white is ideal. There are many forms of racism, not just explicit interpersonal racism. There is also implicit bias and systemic racism, including the policies that perpetuate racial disparities. One of the ways we look at the role that racism may be playing in sickle cell is by comparing the work that's been done on sickle cell to the work on cystic fibrosis. As with sickle cell, people with CF are from all races, but CF is more common in white patients than in other racial groups. There have been more than 10,000 fewer publications on sickle cell in the past 50 years. Estimates in the US are that CF receives more than 3 times the research funding as sickle cell. This isn't to say that research and funding for CF aren't important, because they certainly are, but there needs to be equal attention to sickle cell and questions asked about what role racism might be playing in this discrepancy. Serena's going to speak to us a bit more about the lived experience of patients in the ED.
So the fact that we are called drug seekers or um, we're just hospital hopping, uh, and the pain's not that bad because you know she looks okay. She's not crying. Stuff like that. We hear all the time, and it as you saw in the presentation, it is absolutely not true. Um, just a small percentage of people are dependent on opioid, and the majority of us is not. And all we want is for that type of pain to go away because we're not able to do anything else during that time. Also, anxiety is a lasting effect as well because that exacerbates the pain over and over again. So we're anxious because we don't want to go to the hospital. We're anxious on the way to the hospital. We're anxious when we get there because we're wondering, okay, which staff is there tonight or this morning? Hopefully the staff is educated. I hope they know about the protocol. Um, we hope there's somebody that knows something and knows how to treat people with sickle cell. Hopefully the doctor knows what he's going to do. So all that is, uh, anxiety driven. And then once we get there and then we see that it might be, a long wait, that's when the anxiety hits again. And then the pain is even worse. That's happened to me several times. And that is why most of us just stay at home and try to deal with it because of the fact that we don't want to go to the hospital to have to wait to get treated when we could be doing that on our own at home. And then also our coping strategies. We talk about how I spoke about how someone will say, well, you don't look that sick, or you don't look like you're in pain that much, and so on. And when really we are. But for me, I have to stay stimulated in a different way where I'm not thinking about the pain all the time, because that, for me, it's throbbing pain. So as soon as I think about it, it starts throbbing even more, and it's intense and in the joints. And so what I do to cope is I'm either on the phone, I'm watching TV, or I'm talking to whoever is there with me, my advocate or my family or friend could be there with me. I'm having a conversation with them too, and they will try their best to distract me as well, because of the fact they know once I'm distracted, I'm not focusing on the pain. So those are lasting effects, because it's something that we have to go through every single time that we go there. And, you know, and then we have to be thinking about it all the time, constantly, hoping that we do encounter people that know what they're doing, especially if there is a protocol and they're aware of it right away. The anxiety goes down, the the emergency, you know, uh, the tenseness and everything just eases up a little bit. And, if we start realizing that, the doctor knows what they're doing and is listening to us and actually having a conversation with us as to what is the best course of action in dealing with the pain, then we feel a lot better.
We each have three take homes for you. What I suggest is that you continue to seek out experiences like this session today to increase your awareness of the impacts of stigma and bias in the emerge. Next, that you partner with patients and community members. Serena and I are co founders of an interdisciplinary team in My Emerge created to address barriers to sickle cell care. Here you see Serena on the screen and Ms. Ruth Apia Boateng, one of our fantastic Emerge nurses, about to hold an education session for our Emerge colleagues about sickle cell. The very act of working together in this way is a bridge to building trust. Finally, get to know the protocols at your institution. Work together with patients and community organizations to create them if they don't exist. The Clinical Handbook for Sickle Cell Disease Vaso-Occlusive Crisis is an excellent resource and is included in the accompanying documents.
Understand that we're human beings first and foremost. And, know that everyone's different, everyone's not the same. Everyone's treatment is different, um, but we're human beings. We just need help at the time of crisis. Recognize that everyone has biases. So we're not saying don't have biases. Everybody has, but we're saying try to recognize it when when it comes up, and then realize, okay, this is a human being, this is a patient, this is someone that we need to treat, and so in order for them to feel better, and then just don't judge a book by its cover.
We look forward to continuing on this conversation and to addressing any questions that you may have. Thank you.